if cell phones really were a problem, wouldn't we all be keeling over from brain cancer? Well, I have to be fair. I am trained in toxicology and epidemiology, and in fact, most epidemiologic studies do not show any increase in brain cancer from cell phone radiation until at least 10 years of heavy use. Heavy use in the studies that find an effect is defined as half an hour a day. That was the definition of heavy use. Now, why don't we see an increase in brain tumors yet in the general population? Well, when the atom bombs dropped in Japan, they emitted ionizing radiation to an already weak and sickened population. And the survivors have been studied. And no increase was found in brain cancer in the survivors until 40 years later. We have radically changed our use of cell phones in the past 4 years. We've more than doubled our use of cell phones in the past 3 years. So if we see an increase after heavy use, and it takes 40 years, our grandchildren are going to be paying the price for what we've failed to do. The authors recommend continued research and suggest, in the language of science, an association between cellular phone use and parotid gland tumors. Now, in my book, The Secret History of the War on Cancer, I make clear that we waited too long to take action on tobacco and asbestos and vinyl chloride and a whole alphabet soup of toxic chemicals. We waited because we waited for the body count to be absolutely undeniable and irrefutable. I'm now a grandmother, and I don't want to see us wait any longer to try to protect our grandchildren. As a scientist, I understand the reluctance of my colleagues because the data are not conclusive yet, but they lead me and others to determine at this point that we know enough that we need to act now. And I want to show you some of the newer data. In 2013, Leonard Hardell of Örebro, Sweden, a really widely respected physician epidemiologist, confirmed the brain cancer risk is greatest for those who started to use cell phones before age 20. They have a 4 to 8-fold increased risk of malignant brain cancer within 10 years if they start to use a cell phone as teenagers. He's also just produced a report showing that people who they were able to study in Sweden who've used cell phones for 25 years, because they have data there, because they were some of the earliest adopters, have a 4-fold higher risk of tumors. And the longer they've used the phone, the greater the risk of the tumor on the hearing nerve, acoustic neuroma. This is a bar graph that we just produced this morning showing you, by the way, that the analog phones, those old shoe phones, you know, the big boxy phones, the people who use those phones have a 6-fold increased risk of a tumor on the hearing nerve. Now, these are not malignant tumors, but they can cause deafness and paralysis of the face if they're not addressed. And the risk of the tumor is greatest for the longest-term users. And there is a risk with, it looks like a very unusual thing, that the newer phones, which emit less powerful radiation but have a more erratic signal, may have a greater risk. This is very important work. It should be a call for a national major research and training program, which I testified before the U.S. Senate for in 2009. Now, many of you may have heard that studies find no effect, and I want to just briefly discuss one major, widely publicized study that finds nothing. I want to make sure you understand. The Danish cohort study, often trotted out, began with 700,000 users and then took out all of the business users. Why? Because they said we couldn't be sure that if a business was assigned the user, that the boss actually used the phone, maybe he shared it with everybody. I don't know about you, my father was a boss, and my father had one of the earliest cell phones, and he never shared it with anybody. He was so proud of that thing. It was like, and it was quite complicated to work. Nobody got to touch it. And it cost a lot of money. In 1980, I think it cost like $3,000 for the phone. And it cost maybe $500 a month to use it. But they threw out the business users, who were the heaviest users. They defined a user, and I'm not making this up, as someone who made one call a week for 6 months. It sounds like a really good Saturday Night Live routine, right? Colbert ought to make a lot out of that. They compared rates of brain cancer in those who used cell phones prior to 1995 with rates of brain cancer in all those who used cell phones afterwards, and I'm not making this up. In other words, they took people who used cell phones early on, when they didn't use them very much, when it cost a fortune to use them, and compared their rate of brain cancer with the rate of brain cancer in everybody else afterward that was assumed not to use a cell phone. And this is, in fact, the study that is usually cited as proof that cell phones are safe. Now, here's another piece of information from Denmark that just came out this week. And it's in Danish, but it comes from the State Institute in Denmark. And it shows a 40% increase in brain cancer in Denmark as of 2012. Here. To here. I don't know why there's such an increase in brain cancer. I think we need to find out. Here's similar data in Finland. Now, I want to caution you because cell phones are irrelevant to this increase. This could be due to industrial chemicals, better detection. This increase here, we don't know. Here's similar data in Norway. I don't think we should be in the business of waiting for dead bodies before acting to take prudent precautionary policies.